Liver is actual seat of life. So உடம்போட மெட்டபாலிசம், எதிர்ப்பு சக்தி, ரெட் பிளட் செல்ஸ்ல இருக்க அணுக்கள், எதிர்ப்பு சக்தி உண்டாக்குற அணுக்கள், செல்ஸ் ப்ரொடியூஸ் பண்றது முழுமையாவே லிவரோட வேலை. நம்ம ப்ராபப்ளி பார்க்குற எல்லா மெட்டபாலிக் டிசீசஸ் இப்போ பார்க்கறதுக்கு காரணமும் அதுதான். நிறைய உற்பத்தி ஆகி நிறைய வரும்போது அதோடைய ரா மெட்டீரியல்ஸ் அண்ட் ப்ராடக்ட்ஸ் இட் ஸ்ட்ரகிள்ஸ் டு டூ இட்ஸ் ஜாப். முன்னாடி ஒரு அல்ட்ராசவுண்ட் பண்ணோம்னா 100 பேருக்கு 50 பேர்ல ஒரு கிரேட் 1 பார்க்கறதுக்கான வாய்ப்பு உண்டு. இப்போ ஆல்மோஸ்ட் 70-75% ஆஃப் பீப்புள் கிரேட் 2 வரைக்கும் நம்ம பார்க்குறோம். ஸோ த ப்ரொக்ரெஷன் ஆஃப் லிவர் டிசீஸ் ஹஸ் பீன் ரியலி ரேபிட் இன் டர்ம்ஸ் ஆஃப் ஃபேட்டி அக்குமுலேஷன். த லிவர் ஹேஸ் டு ஸ்லோ டவுன் and take a break for not more than 12 hours. You have to give a complete rest to your liver as much as you give rest to your brain. How your gut works and how your liver works is all interconnected. They all need a break basically, at least a 10 to 12 hour break. If that is not being given, then you are at a very high risk for developing a liver disease. Whereas if you force yourself to take say 4 to 5 liters of water, more than the thirst that you have, you're not helping your liver in any way. So some of the superfoods that we have commonly used in South India works the best. So high vitamin C has been one of the saviors for liver. Jamun is the easiest alternative with the highest amount of antioxidants as equivalent to that.
Hi everybody, my name is Sapna. Welcome to the Doc Talk, where science meets real life, myths get busted and your wellness gets a lot more smarter. Whether you are sipping on coffee, lacing up your shoe or chilling at your office desk, we are making sure to fuel your habits and upgrade your wellness one episode at a time. Let's dive into the first episode, and on this episode we have Dr. Karthik Raj M, peri-operative physician, programming director, liver transplant, 𝐸 International Hospitals. Doctor, thank you so much for agreeing to talk with me. How are you?
I'm fantastic, and thank you for having me on your show. Looking forward to all the questions you're going to fire.
Yes, and I am looking forward to all the insights that you're going to be giving us based on liver, because you're an expert. Doctor, we have so much conversation globally on podcast, on radio, on televisions, on the internet about cardiac health, brain health, mental health, weight gain, weight loss. But something as vital, as complex an organ like the liver is often overlooked. Why do you think that is?
For the simple fact that people don't experience a liver disease in the form as they see the other problems as such. So whatever problems they attribute to talavali, vaithuvali, the indigestion, any of these problems they attribute to, they usually related to the organ that is they think is related to it. But liver, the reason or the function of the liver is not understood. என்ன வேலை செய்யுதுன்னு தெரியாததுனாலேயே அதில் என்ன பிரச்சனை வருதுங்கிறது நிறைய பேருக்கு தெரியாது. ஸோ அது என்னென்ன வேலை செய்யுதுங்கிறது ஃபஸ்ட்டு தெரிஞ்சுக்கணும்.
சார் என்னதான் சார் பண்ணுது உடம்புல?
லிவர் இஸ் ஆக்சுவல் சீட் ஆஃப் லைஃப். ஸோ உடம்போட மெட்டபாலிசம், எதிர்ப்பு சக்தி, ரெட் பிளட் செல்ஸில் இருக்க அணுக்கள், எதிர்ப்பு சக்தி உண்டாக்குற அணுக்கள், செல்ஸ் ப்ரொடியூஸ் பண்ணுறது முழுமையாகவே லிவரோட வேலை. பாடியோட டெம்பரேச்சர் மெயின்டைன் பண்ணுறதுலேருந்து, சுகர் லெவல் ஆப்டிமைஸ் பண்ணுறதுலேருந்து, ப்ரோட்டீன் யூட்டிலைஸ் பண்ணுறது வரைக்கும் everything happens in the liver.
It also regulates glucose.
Yes.
It also regulates
the
metabolism.
Blood. Yes.
Waste elimination, a lot of things.
Exactly. So the metabolism of all the food products has sugar, protein and lipids, as fats as we call them. இது மூணுமே கண்ட்ரோல் பண்ணுறது லிவரோடைய வேலை. ஸோ உணவுலேருந்து உற்பத்தி ஆகிற இந்த பிரேக் டவுன் ப்ராடக்ட்ஸை லிவருக்கு கொண்டு போய் பிளட் சேர்க்கும் போது அதை எப்படி பாடி யூட்டிலைஸ் பண்ணணும் அப்படிங்கிறத லிவர் தான் டிசைட் பண்ணுது. அந்த டெசிஷன் எடுத்ததுக்கப்புறம் அதுக்கேற்ற மாதிரி இட் டெலிகேட்ஸ் த ஒர்க். இட் ஆல்சோ மேக் ஷுர் தட் த மெட்டபாலிசம் இஸ் அட் ஆப்டிமல் ரேட் ஆஸ் பர் த பேஷண்ட்ஸ் ரிக்குவயர்மெண்ட். நம்ம ப்ராபப்ளி பார்க்குற எல்லா மெட்டபாலிக் டிசீசஸ் இப்போ பார்க்குறதுக்கு காரணமும் அதுதான். நிறைய உற்பத்தி ஆகி நிறைய வரும்போது அதோடைய ரா மெட்டீரியல்ஸ் அண்ட் ப்ராடக்ட்ஸ் இட் ஸ்ட்ரகிள்ஸ் டு டூ இட்ஸ் ஜாப். So that's why we have other diseases coming in from the liver.
Right. And நீங்க other diseases னு சொன்னனால நான் கேக்குறேன், what are the common liver diseases that you come across in your daily practice?
So the commonest liver disease that we come across is actually the basic one is cholestasis. Gallbladder la kallu. பித்தப்பை வந்து வீங்கி இருக்குது, வலி இருக்குதுன்னு சொல்லிட்டு தான் பேஷண்ட் வருவாங்க. பெரும்பாலும் இது எதனாலனா அதிகமாக உற்பத்தி ஆகிற பித்தத்தினால. அகெயின் திஸ் இஸ் பை டிஃபால்ட் ஆஃப் தி மெட்டபாலிசம், ஹைட்டன் மெட்டபாலிசம் ஃபார் ஃபேட். அது ரிலேட்டடான ப்ரொடக்ஷன் ஆஃப் பைல், பித்தம், அது பித்தப்பையில் சேரும்போது அதில் வரக்கூடிய கல். ஸோ இது ஒரு காமனான ப்ராப்ளம். அதிகப்படியான பிரச்சனைகள் லிவரில் வரும்போது மஞ்சக்காமால பித்தப்பை வலி, இது ஜாண்டிஸ் அண்ட் gallbladder cholecystitis is what they come with. But the other side of the spectrum is these are indications that your liver is struggling, your general liver health is poor, and where that leads to is it could lead somewhere up to a patient developing diabetes, somewhere up to a patient developing a liver failure, fibrosis and cirrhosis, which ensues after a fatty liver period. So on the initial fatty liver வந்து இப்போ இருக்கிற இன்சிடென்ஸ் ரொம்ப அதிகம். முன்னாடி ஒரு அல்ட்ராசவுண்ட் பண்ணோன்னா 100 பேருக்கு 50 பேரில் ஒரு கிரேட் 1 பார்க்கறதுக்கான வாய்ப்பு உண்டு ஒரு 10 years பேக். இப்போது ஆல்மோஸ்ட் 70-75% ஆஃப் பீப்புள் கிரேட் 2 வரைக்கும் நம்ம பார்க்குறோம். ஸோ த ப்ரொக்ரெஷன் ஆஃப் லிவர் டிசீஸ் ஹஸ் பீன் ரியலி ரேப்பிட் இன் டர்ம்ஸ் ஆஃப் ஃபேட்டி அக்குமுலேஷன்.
ஓகே அண்ட் நீங்கள் ஃபேட்டி லிவர் அப்படின்னு சொன்னீங்க. வாட் இஸ் ஃபேட்டி லிவர்? அண்ட் இப்போது இந்தியாவில் வந்து நான் ஆல்கஹாலிக் ஃபேட்டி லிவர் டிசீஸுங்கிற இந்த டேர்ம் வந்து ரொம்ப காமனாக எல்லாருமே பேசிகிட்டு இருக்காங்க. அதை பற்றி தெரியறதோ தெரியலையோ, பட் எல்லாருமே இந்த டேர்மை வந்து காமனாக வச்சிட்ருக்காங்க. ஃபேட்டி லிவர் என்ன? நான் ஆல்கஹாலிக் ஃபேட்டி லிவர் டிசீஸ் என்ன?
ஓகே, ஸோ alcoholic liver disease is the simplest one to explain. Alcohol induced liver damage. அதிகப்படியான ஆல்கஹால் கன்சியூம் வரும்போது 2 விஷயங்கள் நடக்குதும். ஒன்று வந்து ஹை கேலரிஸ், சுகர் லெவல்ஸ் ஹையாக இருக்கிறதும், அதை ப்ராசஸ் பண்ண லிவர் ஸ்ட்ரகிள் பண்ணுறதும். பை ப்ராடக்ட்ஸ் ஆஃப் லிவர் ஆல்கஹால் இட் செல்ஃப் கேன் பி டேமேஜிங் த ஹெப்படோசைட். லிவர் செல்ஸுங்கிறது வந்து ஹெப்படோசைட்னு சொல்லுவோம். அந்த சின்ன செல்ஸ்க்கு வந்து alcohol can cause, the components in alcohol can cause damage. So high sugar and damage was the cause for alcoholic liver disease.
Okay.
Non-alcoholic liver disease is basically because of increased level of sugar level that constantly hits the liver. So meal after meal the sugar levels are high. அதிகப்படியான சுகரை வந்து லிவர் ப்ராசஸ் பண்ணும்போது ஒரு அயற்சியும் ஒரு டயர்ட்னஸும் இருக்கும். பை ப்ராடக்ட்ஸும் தட் ஆர் ப்ரொடியூஸ்ட் ஆஃப் த மெட்டபாலிசம் அகெயின் ஹார்ம் த லிவர் செல்ஸ், ஹெப்படோசைட்ஸ். ஸோ பேசிக் லிவர் ஃபங்க்ஷனில் ஒரு முக்கியமான விஷயம் என்னென்னா கிளைக்கோஜன் ஸ்டோரேஜ் அண்ட் ஃபேட் ஸ்டோரேஜ். ஸோ குளுக்கோஸை கிளைக்கோஜன் ஒரு காம்ப்ளெக்ஸான ஒரு ஃபார்மாக மாற்றி ஸ்டோர் பண்ணிக்கும். தட் இஸ் ஆர் ஸ்டார்வேஷன் ரிசர்வ். ஸோ அது லிவரில் நடந்துடும். அதை தாண்டி அடுத்து அது பண்ணுறது கார்போஹைட்ரேட்ஸை இல்லை ஃபேட்டை to store it as much as possible for a later day use.
Okay.
So that starts in the liver, and it used to be more of a protective mechanism where there are periods of starvation where you don't get, basically because we are hunters and gatherers initially. So that was how the primitive liver had evolved.
Okay.
So that has not changed as such. So adodiya primitive function la oru function fat storage.
Okay.
But unfortunately the fat storage, what it does is the intralobular distance அப்படின்னு நம்ம சொல்கிறோம். 2 ஹெப்படோசைட்டுக்கு நடுப்புற இருக்கிற ஏரியா வந்து சென்ட்ரல் லோபுலார்னு சொல்லுவோம். ஸோ அந்த டிஸ்டன்ஸ் அதிகப்படுத்துறது, அது ஹார்ட் ஆகிறது, இதெல்லாம் தான் காசஸ் தி damage, permanent damage to the liver eventually.
Right. Can non-alcoholic fatty liver disease or fatty liver disease progress into something as serious as fibrosis, cirrhosis or liver cancer?
Yes. So there are stages of fatty liver disease. There are the 4 stages where the initial first 2 stages are where some amount of restriction on the diet and a reversible activity by changing your lifestyle is going to bring you back to normalcy. But ஒரு பாயிண்ட்டுக்கு மேலே ஃபேட் அதிகப்படியாக லிவரில் அக்குமுலேட் ஆனதுக்கப்புறம் நிரந்தரமாக அந்த ஹெப்படோசைட்ஸோடைய டிஸ்டன்ஸ் அதிகமாகி அதோடைய ஃபங்க்ஷன்ஸை குறைக்கும் போது that what happens is called fibrosis. அந்த டிஸ்டன்ஸ் அதிகமாகி லிவர் வந்து அந்த இடத்துல ஹார்ட் ஆகிடும். ஸோ அந்த ஃபேட் வந்து will become more harder. So it is not part of the hepatocyte. லிவரோடைய ஒரிஜினல் ஆர்கிடெக்சர் கிடையாது. ஸோ அது மாறும்போது what comes into place is called cirrhosis. Fibrosis which leads to cirrhosis. ஸோ இந்த ஃபேட் பிரிட்ஜிங் அப்படின்னு நாங்கள் சொல்கிறது, நம்ம வந்து எம்ஆர்ஐயில் வந்து we can assess. ஒரு எம்ஆர்ஐ ஃபேட் ஃப்ராக்ஷன் பண்ணோன்னா ஒரு லிவர் ஃபேட்டி லிவர் வந்து எந்த அளவுக்கு ஃபாஸ்ட்டாக ப்ரோக்ரெஸ் ஆகுது அப்படிங்கிறத கண்டுபிடிக்க முடியும். இப்போது தட் இஸ் ஒன் ஆஃப் த மொடாலிட்டிஸ் ஃபார் ஏர்லி ரிவர்சல் ட்ரை பண்ணுறதுக்கு. ஸோ ஈவன் அட் திஸ் ஸ்டேஜ் தேர் ஆர் நியூ மெடிசின்ஸ் தட் வி யூஸ். One of the drugs that have come into use recently is saroglitazar. So it is a medicine that can reverse the fibrosis that has happened at stage 2 to 3.
Right.
So this helps reverse this fibrosis and then again improves the hepatocyte functions marginally. So this has to be backed with good sugar control and a change in your lifestyle. So answering your question, fatty liver progresses to fibrosis and cirrhosis, absolutely, if it is not controlled. The second component, is it reversible? Yes, to some extent. Some stage 2 to stage 3, there are ways of reversing it, but not always. If it progresses any further without restriction, then it's a difficult scenario to handle.
My next question was if this condition is reversible, and now that you've answered it, I just want to understand how early does one need to catch this particular condition in order to reverse it?
Okay, that is a challenging question.
Okay.
The reason being, in most cases, the patients who present to us are already diseased. The common people who have to be taking care of their liver are the people who have either a bigger waistline, obese, a BMI of more than 28 to 30. They need to be worried. Diabetic patients, patients with early diabetes up to diabetes without control. These are the kind of patients that are people who are the high-risk population for developing these risk factors. Generally, the nocturnal eating has become the biggest fad that has easily contributed to fatty liver also, because the liver has to slow down and take a break for not more than 12 hours. You have to give a complete rest to your liver as much as you give rest to your brain. So I think even in a previous interaction, stress, how your gut works and how your liver works is all interconnected. They all need a break, basically, at least a 10 to 12 hour break. If that is not being given, then you are at a very high risk for developing a liver disease.
You think I would have fatty liver, doctor? Because I am a nocturnal eater. I'm saying this because ராத்திரி எல்லாம் டின்னர்லாம் சாப்பிட்டு முடிச்சு எல்லாமே முடிச்சு ப்ரஷ் வேற நான் பண்ணியிருப்பேன். ஆனால் அதுக்கப்புறம் ஒரு பசி எடுக்கும். ஒரு 12 மணிக்கு படம் பார்க்கும்போதோ ஏதாவது ஒரு இன்டர்வியூ பார்க்கும்போதோ ஒரு பசி எடுக்கும். அப்போ ஏதாவது சாக்லேட், இந்த நொறுக்கு தீனி, சிப்ஸு.
I think, the basic thing is, for somebody who's thin doesn't mean that they are fat, they don't have fatty liver.
Okay.
On the contrary, when they have these risk factors, primarily a risk factor where you have high calorie nocturnal calorie intake, your risk is very high.
Okay. நிறைய பேர் இப்போலாம் வந்து எல்லாரும் டாக்டர்ஸ் ஆயிட்டாங்க. படித்தவங்க டாக்டர், படிக்காதவங்க டாக்டர், கூகுளில் ஏதோ ஒன்று பார்க்குறது, வாட்ஸ்அப்பில் ஃபார்வர்ட் பண்ணுறதுன்னு எல்லாருமே டாக்டர்ஸ் ஆகிட்டாங்க. டெல் மீ வாட் ஆர் த மோஸ்ட் காமன் மிஸ்கன்செப்ஷன்ஸ் ஆர் மித்ஸ் தட் யூ கம் அக்ராஸ்?
Commonest one, I think, has been hydration. I think there's been a lot of momentum behind drinking more water and that reducing detoxing your liver. Now, in a way, taking adequate water does. Would be taking more water than normally required, would it help? No, it doesn't help. Okay. So anywhere between 2 to 3 liters of water which your body needs, you will have the thirst and urge to drink. The problem is either you have access to water or are you taking intervals to drink the water. These two are things that you need to address. Whereas if you force yourself to take, say, 4 to 5 liters of water, more than the thirst that you have, you're not helping your liver in any way. The liver itself can go for what is called edema.
Okay.
So all the fluid that is going into your bowel and gut again goes through the liver, then back to the IVC and then back to the heart. So அதிகப்படியான flow liver மூலமா நடக்கும், but அதனால toxins போறது கிடையாது. The second myth, the commonest myth, of course, is your lemon water, green tea and honey combination. Now, as much as these provide few antioxidants, there are n number of foods that provide antioxidants. There are good nutrients like omega fatty acids. There are nutrients like selenium, which you have to have in your diet, very difficult to have. You have to have a normal vitamin D level, which most people forget. So these are the micronutrients that you all need in your diet, yes. Okay. But is just drinking lemon water going to change things for your liver? Not really. It does help in a certain way. It changes the pH of the blood to a certain extent. And when your pH changes, the type of metabolism happening in the liver changes, but it's very transient. So it doesn't mean if I drink a glass of lemon water in the morning, my metabolism's all set for the day. It might last for an hour or a couple of hours.
Okay.
After that, it's gone.
Right. Doctor,
Two
now that
commonest
you've
myths.
told me water is also not helping, tell me what is the ideal diet or what is the dietary requirement that is extremely beneficial for liver health?
I think the answer is in the question. So you have to know your dietary requirement.
Okay.
Somebody who's on the indoors needs more vitamin D.
Right.
Somebody who doesn't exert themselves outside doesn't need as much calories. Somebody within the age groups of 18 to 40, in the male, the amount of protein requirement would be somewhere around 1 to 2 grams minimum per kg body weight, and a female would be somewhere around 0.5 to 0.75 gram per kg body weight.
Per day.
Per day. So this is the amount of, and you can take plant protein. It's not necessary that you have to force yourself on animal protein or egg protein. So again, these are the myths that we want to address. So good protein intake, micronutrient intake. You need all your keratin. So you eat a lot of carrots and cucumber and get all your micronutrients in. You need all your potassium and vitamin D, magnesium and all those things. So micronutrients are the key to good liver health.
Okay.
The calorie intake is the challenge here.
Okay.
So you have to address your peak demand of calorie in a day. For somebody who has an active day in the first half of the day, they take the calories then.
Okay.
Somebody who has the second half of the day with high calorie output, you take your maximum calories then.
Okay.
And minimum of 8 to 12 hours of fasting period is mandatory. Both for the bowel and for the liver, a break of more than 8 hours is mandatory. So you give that and everything else is sorted.
Doctor, you told me carrots, cucumbers. What else can be beneficial? Just a simple food.
Okay, so superfoods.
Okay.
So some of the superfoods that we have commonly used in South India is works the best. So high vitamin C has been one of the saviors for liver. So amla nellika is one of them. Your drumstick.
Okay,
Murungaka. And of course, something that we don't usually add in the food but don't end up eating, your karvappala. So all these things have the level of antioxidants that are specific for the liver.
Okay. Okay.
So your liver functions improve with these micronutrients in the type of vitamin C that is available.
Right.
So it is not just with ascorbic acid, but what type of ascorbic acid, vitamin C is available is also important. The dose and the level is adequate in these. Now, there are also other things that we need to add to this. There are foods that are bitter and a little sour.
Okay.
We don't tend to take. Have you ordered any food which is bitter?
No.
In a restaurant? Never. No. So you wouldn't ask for your pavaka without being forced down to have it. Or you wouldn't be asking for something like all the tamarind, the sour chutneys or something, unless otherwise you're having some other dish. So these are the two types of food that carry the enzymes which are required to reverse the liver damage.
Okay.
And also for diabetes. Commonest myth with a lot of people is when you take bitter food, your sugars come down, but it's not the same for all the foods, but with a certain amount of foods. The bitter gourd is one. And of course, with your neem, your tamarind. So that is another one which helps with your sugar control. One of the reasons why we use it commonly in rasam, our food digestion is used. I mean, it used like a digestive juice for this
Puli.
That helps again with your metabolism.
Right. So murungaka, pavaka, neem, curry leaves, nellika. So anjal.
All vitamins, yeah, superfoods.
Beautiful.
These are known superfoods. In fact, they are the most exploited across the world. Moringa is like its biggest market world over. Amla, as you know, it's again a big market. There are of course other things that they try to push, Shilajit and other things which are a little harmful because they are not exactly the pure extracts of what they claim to be.
Okay.
But then again, yeah, you can have them if you want. I think I would have missed jamun. Jamun, Navaparam is another excellent fruit that you can have. Again, very rich in antioxidants, equivalent to blueberries. If you can have blueberries, then of course blueberries.
But they're very expensive, unfortunately.
Jamun is the easiest alternative with the highest amount of antioxidants as equivalent to that. And I think it tastes better too. So
Yeah, Navaparam. Yes. Now that we've spoken about dietary requirements and the superfood, tell me, is liver health and gut health any way related, and do they affect each other?
absolutely. So in good health, you need really good gut activity. So somebody who is able to take a 3-course meal and is able to digest it well is somebody who you assume as somebody with good gut health. So if they have any indigestions or bowel disturbances, then you will understand that they have some gut difficulties. But generally, somebody who has a good gut health will also have a good overall general health. The reason being, the gut health is predominantly based on the microbes you have, the microorganisms that are already in the gut, the type of food that you take. Again, that also matters to the microorganism.
Okay.
So something like the overnight soaked rice. So that is what kind of improves the microbiota of the gut.
Okay.
So whenever the microbiota of the gut is good, the colony count is high. As we tested, if you want to look at it in the medical sense, the colony count is very high per square centimeter of the gut. It means that the liver health is also going to be good, because this drives the metabolism of the liver. So anything that happens with your gut is interlinked to your liver. And of course, in a disease process, if a person becomes a patient and develops a liver disease, cirrhosis, we always find that their gut health is poor, associated with the liver, meaning they will have the 4 layers of the gut, and the mucosa is the first layer between the food and the bowel itself. So that the mucosal integrity is usually gone in a patient with liver disease, and vice versa. So this happens first, liver disease happens first. It can be the other way around. You have what happens is the microorganisms from the food enter the bloodstream, causing infection in a liver patient. So it puts them at risk. So that leads to all the way up to a UGI bleed, encephalopathy, and all the symptoms and signs that you see associated with the liver failure. All this is because of your pure mucosal integrity, and that happens because your gut health is poor, and again, gut health is poor also with the liver health. So these two go hand in hand. Your gut health and your liver health, they go hand in hand, and the better microbe count you have, the healthy microbe count you have in your gut, ensures both your liver is functioning well and your gut is also doing well, and overall health is guaranteed.
Poor bowel movement is proportional to
Liver disease?
liver disease?
Yes. In some instances, some of the direct diseases have been attributed to be associated with liver disease.
Right.
But not, it is not to the extent that the liver goes for a failure.
Okay.
There is a liver slowing down generally with a lot of bowel diseases that we know.
Right.
But certain bowel diseases is associated with the liver failure also.
Okay.
Yeah.
Okay. So constipation and
They're
people
all
generally
signs,
having difficulty with excretion.
Early signs of your liver slowing down.
Right.
And probably this causing a liver not a failure, but presetting your liver to go in for fibrosis and cirrhosis later on. And the other way also. So if you have a cirrhosis or a fibrosis setting into the liver, you will start having symptoms of constipation and poor gut motility.
Doctor, also tell me how much of a proactive care does someone with a family history of liver conditions need to have, or need to take rather?
Liver disease going genetic, there are a few number of cancers that have been attributed. There are conditions you see in children where there's a condition called biliary atresia, where the bile duct is not properly formed at the time of birth, and then they have to undergo a procedure called 𝗂𝐶𝐽, which has a 50% success rate, which means 50% failure. And then those patients would end up requiring a transplant by the time they are less than 8 years of age. So usually after 5 years of a failed 𝗂𝐶𝐽, we try to do a transplant. So these are genetic disorders that are inborn, where the biliary tree is not formed, the liver is not fully well developed. There are conditions as such. But these have a few genetic attributions, yes. But the percentage of these liver diseases, as we see, are far, far less compared to the diseases we see otherwise. In terms of metabolic NASH-related diseases, alcoholic diseases, and viral etiologies, there are far more number of cases happening in them.
No proactive steps needed at all?
I mean, the simplest things to do is take care of yourself.
Okay.
And meaning you take care of your diet, you take care of your sleep. So it is a general wellness that you have to focus on, which is going to take care of you. And probably if you at all have a family history of liver disease, taking care of these basic steps will get you out of trouble.
Why do some people with liver conditions do not show any alarming signals until it's very late?
The basic thing is, if they don't see any symptoms attributable to the liver, they will not complain about liver.
Correct.
That is as simple as that. But the problem is this, that whenever they have a symptom, they attribute it to the system that they know most about. When you have reflux disease, GERD, when you have obesity, you attribute it to those problems as such.
Sorry,
Obesity.
Just one layer deep. Reflux disease is basically acidity.
Yes.
Gas.
Acid reflux. Yes.
We say yes.
So
okay.
acid reflux happens because of a few reasons.
Okay.
One of them is because the lowermost esophagus, where the esophagus continues as the stomach, is not an anatomical closure. It's only a physiological closure. It's a pressure closure.
Okay.
So there is a higher pressure and a lower pressure. So it doesn't flow back. Now, what happens is there are three things that are happening here. Somebody who is obese has a distended abdomen. They lose the muscle control and the pressure, maintaining the pressure, and they tend to have a GERD. People who eat late in the night and then go to a reclining position, they have a risk of GERD. The third component is metabolic diseases, where the diaphragm becomes very lax. The diaphragm is a muscle which separates your lung and your abdomen, the thoracic cavity and your abdomen.
Right.
Now, it has an opening through which the esophagus continues as the stomach. Now, what happens is when the muscle is lax, again, there is a reflex of food particles and acid into the esophagus. Now, all three can happen in liver disease.
Okay.
Obesity is a risk factor for liver disease.
Right.
So is the diaphragmatic tone being lost.
Right.
And also the habit of eating at night.
Yes, doctor. So are there any signs that would prompt anyone who is watching this that they should go and see a liver specialist ASAP?
Absolutely. If somebody feels a little more lethargic than they were, tiredness, they're having an increase in their waistline, they feel more that their bloating sensation is much higher than normal, which they had previous year or week. So then they have to go check themselves. The idea is you can do something as simple as a screening test, where you don't have to do a blood test. You could do what is called a fibroscan. So fibroscan is a little different from all the other scans that we do. It is a point of, it's like a pen. They just put it on multiple places over the liver area, and then it sends in a vibration, collects the information back. It tells if the liver has gone fibrotic or not.
Okay.
So early fibrosis can be picked up by the fibroscan. It's a screening tool. It's not a very accurate tool, but it's a screening tool. Should you have any changes, then you could probably go for a blood test and an investigation. This said, the simplest things that you can go for a blood test, the things that will show you that you are ready for a blood test is, if you do your HbA1c, your blood glucose level, the maintenance of it over a period of 3 months can be assessed with a HbA1c value.
Okay.
So that a GGTP value, gamma glutamate, the liver function test. So those two things can give you an idea if your metabolism is in place. And again, if you are having any endocrine disorders, like for example thyroid or hypothyroid, any of those conditions, again these tests make it more easier to detect early if a liver disease can come on.
We've spoken a lot about food, about alarming signals. There's so much more that we can actually have in this conversation. But yes, definitely in the episodes that are going to be following. Thank you so much, doctor. Some of them were very alarming to me personally, considering I also am having this increased waistline, sense of bloating all of a sudden. So I think I'm definitely going to visit your hospital soon.
Okay, we'll take care of you.
Yes, thank you. Thank you so much.
Thank you for having me. I think it was a fantastic discussion.
Thank
Nice
you, doctor.
questions and
Many more to go. Thank you so much. Thank you.